This longitudinal schematic section shows the relationship of the underlying bone to the soft tissue. First, there is the osseous crest. Then, just superior to the crest is the connective tissue attachment to the root surface. Above that, here it's shown on enamel, but in the adult, the epithelial attachment will be on the root surface. Then, the gingival margin, the upper border of the gingiva. In healthy sites, the gingival margin is found over the enamel or at the junction of the root surface and the enamel. This junction is called the cemento-enamel junction, or CEJ. So what is keratinized tissue? Many people incorrectly use the terms keratinized tissue and attached gingiva interchangeably, but they are not the same. The keratinized tissue is all of the tissue from the gingival margin to the mucogingival junction. It is comprised of the free gingiva and the attached gingiva. The attached gingiva is the portion of the keratinized tissue that is bound down and extends from the base of the sulcus to the mucogingival junction. The base of the sulcus is found by probing. So if we look at what happens in development, a baby is born with a ribbon of gingiva on the ridge crest. The width of that ribbon can vary from person to person and also within an individual. Some areas may be more narrow and some wider. If a tooth erupts through the gingiva just facial to the ridge crest, or misses the ribbon of gingiva, there will be thin gingiva, or only mucosa facial to that tooth, and that can lead to recession. A lot has to do with the eruption pattern and the size of the teeth relative to the width of the ribbon of gingiva. In this child, you see the presence of primary canines and 4 incompletely erupted adult incisors. If we draw on the mucogingival junction, there is a little greater dimension of keratinized tissue here and a little less in this area, because the lateral is slightly rotated and has erupted in labioversion, missing part of the ribbon of gingiva on the crest. This side is at risk for recession due to thinness of the gingiva and the prominence of the tooth. However, there is potential for improvement during growth up